Yeah, but the real problem is it's gotten so expensive.
Yes, and it's gotten very out of hand.
Either way,
and the biggest reason for bankruptcies in this country.
Where is the expense coming from?
There's many arguments with the expense.
Well, three.
Salaries, uninsured right now.
Absolutely, there you go.
The hospitals have to cover their expense, so they jack up their costs.
What about malpractice?
It's 0.07.
That's all.
0.07%.
Exactly. So there's some things in our
Illegal
system.
immigrants, but I don't know how you solve that
but
problem.
there's other problems here that are contributing to this problem. And to throw out a system that works for 85% of the people is not necessarily the best solution.
I don't know how. I honestly don't know how.
How many people don't even become doctors?
I'm not afraid of government insurance. I'm not paranoid about it.
Have you ever talked to a doctor who's practiced in a socialist country? You ever talked to, for example, my mom's doctor's from Costa Rica, and as a matter of fact, I know that he's a Democrat, and he was just very even about it. He's like, Americans they're not going to like it. Americans don't like waiting in line. Americans want it now. And he said, when I became a doctor, because it was a socialist system, he got educated under the socialist system. And then he had to kind of pay back his education by working in the socialist system. And so there were 4 doctors for 80,000 people.
So can I go private then if I want? Go to a private system instead of
What, in Costa Rica?
I do that now with my mail. I don't use the post office. So you have no ass. I don't go to
But that's exactly what's going on in Europe. And that's what all the people that are touting this great socialist system in Europe aren't taking into account. For example, my friend in Norway, he was just, we have this great socialist system. Well, one thing that he told me is he's got a company doctor. So he has all his routine medical tests and all that taken care of by his company. But it's a socialist system. But not all other Norwegians have that private doctor with his company, with his good job. And nobody who's touting these socialist systems is reporting the details. And for example, like in Northern Ireland, in Belfast, I talked to someone who lost their father and their father-in-law to out egregious medical care in the emergency rooms. They died. And so this couple I was talking to, they both had private. They both, no, not just specialists. This was just a heart attack in just the emergency room. It wasn't a big complicated thing. And so what do? Out of defensiveness of seeing their parents die, they buy private health insurance. So yes, maybe there's some kind of.
It's an option. Just think about it.
How are you going to keep the best doctors in the world? You're not.
They have no place to go.
As it is, you're getting all the best doctors in the world from all over the world because ours can't afford to become doctors.
Emerging economies that might like to take advantage of that.
And here's another thing that's going on, and nobody's talked about it all the
when my
closings
kids
of
get old,
all
I'd like
the
to preserve
hospitals
some
are
of this for when
closing.
my kids get old.
You see all these hospitals are closing because the hospitals are being bought up by the groups. What are they called? Advocates. What a name, advocates. They bought up all these hospitals. They close them one by one, tear them down, put in private housing.
You're saying Medicare is going broke. What's this?
Oh, I'm saying we want what we want. We don't want to pay for it. I'm very happy with my insurance.
There's a public option. I'd like to have the option not to pay for it.
You don't use it. Okay, well.
I do use it. Unfortunately. So you're paying.
Well, I'm paying.
All I know is that
and I'm paying for the denials that I've got.
Are you from Eastern Europe?
No,
Okay. Well, I know my dad back in the 80s, he had colon cancer, and unfortunately it's a hereditary thing, we found out. And all of his cousins that got it in Slovakia, they're all dead. They're all dead 20 years ago. My dad lived an extra 20 years because of our medical system. They, over there, they have to give a bribe pride. When their poor father is old and sick and they need to get him in the hospital, they have to, not only do they have to come up with the money and bribe, but they've got to find the right person to bribe.
I don't know if that's the model we'll go to. I don't know.
But when you go to mass,
It's probably not. I don't know. The United States is probably not going to go to that extent. The problem is
there's a lot of things that happen in the United States that I'm very surprised at. So I'd like to believe you, but what I've seen in the past so many
Not in
years,
that
you never
level.
know.
What you brought up is in the level of belittlement.
Okay.
Things do happen to what I understand, on the correctional and or the hospital level. Not on everyday basis. When you're gonna go see the doctor and bring a box of candy every time you're going to see a doctor, is that what you're referring to? I don't think that's something that can happen in the States. The concern, my concern is having somebody sitting who doesn't have medical education, also frankly doesn't care, just comes there to collect a paycheck, to sit and make a decision. Should this person get this treatment? Should this person get that?
Why don't we fix Medicare, Medicaid, take